How to Read a Mammogram, brought to you by MammoGuide. Interpreting a mammogram is the most basic skill in breast imaging. Everyone says you need a systematic approach, but nobody tells you what that approach is. So today, in the next 5 minutes, we are going to teach you a super useful, comprehensive approach to reading a mammogram. This isn't the only way to do it, but it is one way, and a good way, to ensure you don't miss anything. So here we go. First, you want to start by making sure that images are technically okay. A few general requirements. You want to ensure adequate compression, no motion or artifacts, and correct technique. The images aren't too dark, they're not too light. Next, on the MLO view, you want to look and make sure the pectoralis muscle goes down to the level of the nipple. Next, you want to ensure that the inframammary fold is open and not drooping. Next, you want to make sure that the glandular tissue is not cut off posteriorly. Switching our attention to the craniocaudal view, the posterior nipple line is a line drawn from the nipple to the back of the image on the craniocaudal view. This should be within 1 centimeter of the distance from the nipple to the bottom of the pectoralis muscle on the MLO view. Next, you want to ensure you see a little bit of retroglandular fat at the posterior aspect of the craniocaudal view. You want to ensure that you include adequate coverage of the medial tissue. And finally, you want to ensure that the nipple is in profile. Next, once you've ensured that the mammogram is technically okay, you want to take a quick general overview of the image. We like to use the 3 S's, looking at size, symmetry, and surgery. Compare the breast side to side. From here, you're going to compare with prior studies. The more prior exams you can obtain, the better. You want to ensure that you can at least go back 2 years. If you see a small mass or asymmetry that's been on the images for several years, you're done. No further workup is required. From here, you're going to look closer at the MLO view. We're going to employ a technique called shade symmetry. We are going to look specifically only at 1/3 of the breast at a time. When you first do this, you may want to actually take a piece of paper and cover the rest of the breast. This will allow you to really focus in and compare side to side with the right and left breast. So we're going to start looking at the upper third, then moving to the middle third of the breast, and finally to the lower third of the breast. From here, we're going to magnify the image and again repeat those same steps, looking at the upper third, the middle third, and the lower third of the breast. In this magnified view, we're looking specifically for groups of calcifications. From here, we are going to look at the 5 key spots that we want to ensure we include in our evaluation of every MLO view. First, we want to look specifically at the axilla. Next, we're going to look closer at the nipple subareolar region. Approximately 20% of cancers occur in this region, and they can be very difficult to detect. From here, we're going to look at the edge of the glandular cone. At this interface is where the majority of breast cancers occur. So you want to ensure that your eyes make a rim around the outside of this glandular tissue. Next, we're going to look a little closer at some danger zones. These are areas of fatty tissue where really nothing should occur. That includes the retroglandular fat, the fat superior and inferior to the glandular tissue, as well as taking a quick look around the skin and edge of the film for any abnormalities. And the final step of evaluating the MLO view is to look for the whitest, brightest thing on the film. This is just a little trick, but it's amazing how often cancers will appear as the brightest thing on the film. From here, we're going to look a little closer at the craniocaudal view. We're going to employ that same shade symmetry technique, this time starting looking at the lateral third of the breast. From here, moving to the middle third, and finally to the medial third of the breast. Next, we're going to magnify the image and again repeat those same steps, but specifically looking for calcifications in the lateral aspect, the middle third, and finally the medial third. Then we want to make sure we look at the 5 key spots not to be missed on the craniocaudal view. And these include the lateral breast, as the majority of breast cancers occur out laterally. Next, we're going to look again closer in that nipple subareolar region. From there, we're going to do this edge of the glandular cone. Again, at that interface, a majority of cancers occur. From here, we want to look at the danger zones, the areas of fatty tissue where nothing should be present. This includes the retroglandular fat, the medial breast, and again, looking at the skin and edge of the film for any subtle findings. Finally, once again, we want to look for the whitest thing on the film. Finally, we want to look at any tomosynthesis images. If you have these 3D images available, you want to scroll through the cine images, and with this you're particularly looking for areas of architectural distortion. And then finally, if you have not done it already, you want to look at any computer-aided detection. So click the CAD on and off and just give a quick second look to any area that's marked. The vast majority of these markings you can ignore, but every once in a while it will highlight an area that you may have overlooked. Again, this is How to Read a Mammogram. For more information, please visit us at MAMMOGUIDE.com. There is this handy PDF document available for free at MAMMOGUIDE.com. Thank you.